One of the key things about gene therapy at the moment with AAV based programs is the prevalence of pre-existing antibodies in the population, because that can, in many of these programs, exclude individuals from taking part. So we're going to see data that is presented at this meeting about prevalence. We've seen that AAV5 has a geographical prevalence, and maybe up to 50% of patients are positive for AAV8. So we do see that there's a lot of information that we're now accruing about pre-existing antibodies, but the question really is how comparable is all this data? Unfortunately, when we talk about antibody levels, there is really no defined, unified assay system that is being used to measure this. We hear about neutralizing antibodies, binding antibodies, transduction inhibition. All these things might mean different things, and different assays will be assaying them in different ways with different levels of sensitivity. So it's very difficult to compare program to program and data set to data set in terms of actual meaning, in terms of whether these antibodies are going to influence gene therapy and access to particular gene therapies. But it's a really hot topic at the moment to actually understand how frequent these pre-existing antibodies are, whether they are truly geographically variable, and finally how much impact they're going to have potentially on the efficacy of the gene therapy. Most programs are actually excluding patients that are antibody positive, but uniQure programs are not. So it's very much something that we're going to be keen to keep an eye on, understand and follow the data. And the data that we've heard at the meeting already is really piquing everybody's interest. In terms of standardizing these assays, it would be a great thing to see some of this being done so that we can start to more rationally compare the information that we have. And I would hope that various groups could get together from a purely academic standpoint and try to share the information, share the samples to actually bring it together. At the end of the day, it's going to be a very important piece of action and work to do for the patient community and the scientific community to standardize these assays. So I'm hopeful that we might be able to move forward and see that actually happen.